My name is Chris. I'm the healthcare director. My main role is to oversee the healthcare needs of all of our residents, that being from making sure that their doctors are taken care of, that their medications are taken care of, that any kind of add-on services for home health or hospice or physical therapy are all coordinated through me. As the healthcare director, I also manage my healthcare team, which consists of med techs and CNAs and caregivers who will provide care for the residents in any direct capacity. And I oversee them with teaching and doing hiring and guiding them through their everyday. Make sure the residents are taken care of with their basic needs. I'm oversee all the assessments for pre-move-in. I go and visit them at their house. I deal with their needs are, what their health background is, what medications they're on, and then I work with the families and work with the residents on the move-in process. So I got into senior living a couple years ago. I've been in the industry, not in senior living, but I've been in the healthcare field since I was 18. I was a medic in the Army. And when I got out, I couldn't decide if I still wanted to continue medical field or do something different, and then decided I was going to be a phlebotomist, and then went to nursing school because I just wanted to continue doing more. And then I went and worked at med-surg for about 3-4 years, and it was kind of just patient turnaround constantly. Never really was able to connect with my residents or my patients. And then left there and went to skilled nursing, and was in skilled nursing for 3 years as an assistant director of nursing. Doing that, it was kind of the same thing. It was, patients were more of a number than just a person. It was fun, but it became draining. So I looked into other roles that I can do as a LVN and found assisted living, and came in, realized that it is more rewarding than anything I've done before. There's more to being a role as a nurse than just being there and doing a skill. It's a lot of emotional support. Working in senior living, I really like it because I'm able to visit with my residents. I'm able to talk with them, share stories, be able to see them on a daily basis, be able to see them from the time they move in to the time they move out. It's incredibly rewarding. It can be incredibly trying at times. At the end of the day, it is part of nursing that you will never experience anything else. Not only do you get to use your skills as a nurse, but you also get to use your skills as a manager, as a person just talking with residents. And sometimes those things are harder than just being a nurse.
My name is Evelyn. My role here is as a resident care director. Being a resident care director is basically making sure the residents are getting the care that they may need here. Doctor's orders are being followed. Being like the go-between the residents and the doctors for the family members. Family members will come to you. They notice something about their loved ones, they'll let you know. If the resident is off her baseline, get in touch with the doctor and find out what is going on. Anything that they need, basically. And also to be a support for the care team. I know some care teams, sometimes they get into this industry and they don't really know what they are doing. So I'd be like a role model for them, teach them on things that they need to do, how to take care of the residents, always be there for our residents. So here is the attachment that you get with your residents. It's more like a family. You go into the clinic, you just do your clinical work, and then you just leave. You don't have that attachment with the patient. Over here, it's more like a family. You want to make sure that resident is comfortable. It's more of the attachment that you have with the residents, and you're able to meet their needs at the end of the day, how they wear the smile on the face and you see them happy. It makes a difference, unlike being in the clinic setting or being in the hospital setting. I originally came from Africa. I was so close with my parents when I was back home. And so when I came in, I went straight into giving care. And that is something that I fell in love with because I started off as a CNA. And when you go into work, the way you talk to the residents, they tell you their life history, how they are so nice to you. You learn so much from them. It's something that I looked at and I was like, no, this is something I really want to be in, because that comforting feeling that you get at the end of your day talking to a resident, making sure, well, they're having a good day. You can go in sometimes, residents are having bad days. You sitting, touching their hands, holding their hands and talking to them makes them feel better. I went from CNA to a med tech, and I thought, you know what, I can do more for them if I become a nurse. And so I went ahead to do, because I just wanted to be able to help in other ways as well. And so I just went ahead, did my course and became a nurse, and I still love it. What inspires me to come to work is seeing the satisfaction on my residents' face when you're able to help them through something that they're going through. And so that's my drive, being there for them. Yes, it's an awesome place to work. Don't just look at the money aspect of it. It's the love for the job. Come in here and you see that, hey, you're doing something good. It gives you that satisfaction. This is an industry that can help you grow. It's something that I would advise that people look into, because you will really love it, just like I do.